Midlife isn't just a physical transition, it's a mental and emotional one too. Many women tell me they feel less certain of themselves, more mentally foggy, or quietly questioning who they're becoming, especially as their hormones, mental health, and life demands all shift at once. This episode is about giving you tools to build a positive mindset, reconnect with your confidence, and support a stronger sense of self as you move forward. Welcome to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week I bring you evidence-based conversations to help you navigate midlife with clarity, confidence, and compassion, especially when the changes you're experiencing don't always come with clear explanations. In today's episode, we're focusing on something just as important as hormones and physical health, your mindset. By the end of this episode, I hope you'll understand how to build a stronger sense of self during midlife, even when big life changes make things feel unfamiliar. Simple, science-backed strategies to support brain health, learning, and mental clarity. Why stepping back from alcohol can change the way you think, feel, and relate to yourself. And how redefining sobriety can open up a space for confidence, connection, and growth. You'll be hearing from clinical psychologist and adjunct professor of practice, Heather Irvine Rundle, neuroscientist Dr. Lila Landowski, alcohol coach Sarah Rusbatch, and media personality Maz Compton. This information is general in nature and not intended to replace personalized medical advice. Always consult with your healthcare provider regarding your specific situation. I know that we both have a passion for women in midlife.
Yes.
And one of the themes that I see repeatedly is people really struggling with what their identity is. So they've been the mum of, or they've been the wife of, or the partner of for a long time. And suddenly everything's changing. It might be an empty nest. It might be the end of a very long relationship. It might be a change in employment, but everything feels different. Or maybe everything's the same, but they just don't actually know who they are anymore. Can we jump into that? Because it is a repeated theme.
Yes.
Over and over again. What is going on?
Yeah, look, there's many aspects. Of course, as we age, we different priorities. We also have different hormones, as I don't need to tell you, and different cognitive processes that go on. So if we take, for example, identity, and if you think about a little girl that was called Shauna, you might have known her, she would have dreamt. She would have had a dream about how her life would have looked. Probably would have involved kids, pets, house, husband,
Swimming pool?
swimming pool. Okay. But by and large, it probably went to about the age your kids started school. May have extended to when they got to uni, may have, but unlikely. So what you had was a dream that only lasted so many years, and you would have worked towards that, and you would have had the engagement, you would have had the dog, you would have had the wedding, you'd have had the kids, you'd have got the house with the pool, and got the kids to school, maybe got them into high school, and it might have stretched to uni, but really after that there was no idea of what your life would look like, because most women dream of themselves and everything is sort of them in relation to a something or a someone, but it isn't necessarily related to themselves. Whereas men's dreams or males' dreams often relate to themselves and how they may have others, but it, by and large, it involves them and perhaps a car or a boat or a career, which means as relationships change, their identity doesn't move so much. And so one of the things we see for women around midlife is they haven't dreamt about what that midlife period of time would look like. And if for many of them there isn't a career or something, perhaps a hobby that can hold them in terms of their sense of identity, then it can be a very difficult time because they don't know what this was meant to look like. And certainly we still have this idea of women as being community givers, as being in relationship with someone. And that tends to be our estrogen. It tends to be a lot of the ways that our brain works because, we're the caregivers. We relate to others and we're very good at it. But when it comes to self, so when I work with women, we do identity work and I get them to tell me their top 10 values. Now, it's always funny Because when I do that and don't give them any more instructions, their top 10 values will always be relationship values. So there'll be kindness, caring, honesty, those kind of things. But all those things are in relation to someone else. So I say to them, okay, but what about if you're on a desert island? There's no one else there. What would your values need to be? I can give you anything that you like. And often for some women, it's the first time they really thought about who they would be if it wasn't in relation to someone else. So then you get these ideas of creativity, or it could be religion, or it could be that it comes in the form of nature. But a lot of them haven't thought about it before then. So a lot of the work that I do with women is about saying you're allowed to choose 5 that are to do with other people and 5 that are just to do with you. And that can then become the platform under which they start to really get these sense of self going that's not just in relation to others.
I love that, because that really resonates with me because, and I'm sure people listening, because I've literally just had a birthday that coincides with Mother's Day. That's not great, by the way, 2 for 1 and all that. And I get asked the same question by my 4 kids. Every time it comes up to a birthday, they always say, we don't know what to buy you. What do you like? What are your hobbies? And, whereas with my husband, who's pretty much obsessed with boats, no one has any dilemma as to what to buy him. It always involves boat shoes, boat jackets, things for his boat, compasses, books, And the reality is actually, sadly, and it is a bit sad, that no one can think what to buy me, because I think, well, what is my hobby? And it's like, well, I really love our dogs and I really love my kids, but actually
relationships, aren't they?
And so and so for my birthday, I got lovely presents, but they were like mugs with pictures of my dogs, of my kids on them.
There you go.
And so that actually, your answer wasn't long-winded. It actually really struck me, because I'm like, okay, this is me.
And if I present at conferences, and I will say to the group, because it's often parents, which means there's a larger proportion of women there often. But anyway, the point's still the same, that if I say to the group, look, men, can you tell me, what's your toy? None, above board stuff. But what's your toy? What do you enjoy doing? They will name fishing, they'll name cars, they'll name soccer, they'll name footy, they'll name something. And I say, okay, women, what's your toys? What do you enjoy doing? What's your play? How do you play? And they all look at you quite blankly, like I'm not sure, because the things that they play with are the kids and the dog, and they make family arrangements, and so it's to do with others. So it leaves us in this position where, when we don't have the others, and I know that one of the big things in midlife is, of course, preparing for or in the midst of empty nesting, when you don't have that focus because you haven't seen yourself living in your home alone when you were a little girl. I don't think that was part of your dream.
No, definitely not.
It wasn't. You didn't see yourself swimming in a swimming pool on your own, I'm sure.
No.
It wasn't. You didn't want the pool for you, did you?
No.
You wanted the pool for your kids.
Yeah.
And so this then, what do we do when the kids leave? Because we haven't dreamt that far. So it's a very difficult time for women.
Yeah, absolutely. I know I've got 4 children, and I know whenever my first son, even he went overseas for about 6 months, and I genuinely had like a hollow pain in my chest for 6 months with him not being in our house. It didn't seem right. It didn't feel right. It was like someone was missing. And obviously he was off living his best life, which was amazing. I helped him organize the trip. I was very supportive, but it was awful. And I think, and I've now currently got 2 at home, and I think, what's it going to be like when they go? It's going to be awful.
Yeah. That real sense of loss, as you say, a real sense of grief, and getting to know yourself as something other than a mum.
Well, because I often used to introduce myself to people as, I'm Patrick's mum, or I'm Grace's mum, or I'm Madeline's mum, or I'm Quentin's mum. Sometimes I didn't even have a name.
No. That's right. And I think that suggests how our identity is so wrapped up in relationships. And I mean, historically, we were known as Mrs. Such and Such, which, the translation, it just means wife of. We didn't have a name in our own right. We just became the wife of someone else. And then, of course, we become the mother of the children. And who are we as an individual was something that, just wasn't relevant, I think, in society, and that became something that was a societal process, but also very much, as we know, we've got more rights now, and definitely not where we'd want to be. But even with more rights, we still seem to involve ourselves in identity that belongs to others on many levels. Yeah.
One of the things that I feel when people are struggling with the whole empty nest syndrome is they feel very embarrassed by themselves. They feel like they know they've done a good job and they know that that's what they wanted for their children to be independent. And so there's definitely a sense of shame that, they don't have the right to feel the sadness that they feel. But for some women, they can feel really quite bereft. If anyone's listening and feeling like that, like, will the pain go away? Does it get better? What should they do? What are your tips? And
Well, like with any grief, everyone has their own journey, and for everyone it looks different. What we are looking for is some cognitive profiling around thought processes. So, if we were to work with someone like yourself, possibly, I haven't asked you what your cognitions are, but at some point, if I dived into it, you might have said to yourself, I am sad, but I can handle it. And what you can see there is that there's a sense of this pain, but a capacity to keep going. What we'd be looking for in these mums is, can you hold the pain but feel like there's some capacity to keep going? What is the cognition that says, I'll get through this time? What is the cognition that says, every day will get a little bit easier? Whereas where I get more concerned is when I hear a woman say, I'm in so much pain, I feel like my life is over. I feel like I'm nobody. I feel like I have nothing. And they're the women that I want to work with to really challenge some of those cognitions. Of course, whenever you work with a psychologist, I'm going to go back to childhood, or a good one should anyway at some point if it's relevant. But really see when those cognitions started and how the relationship with their children might have really helped with some of the negative cognitions they've been carrying around, a sense of purpose, a sense of kind of achieving something. And so therefore why then when the child moves away, they can no longer hold those perhaps more adaptive or healthy cognitions because they were tied in with the children rather than within self.
And probably a lot of the cognitions behind all this has been developed from an early age, in that you've probably been sort of set up to be a carer your whole life.
Yeah, and as many women are, I mean, we are often congratulated on being kind, congratulated on putting people before us, congratulated on serving somebody else. And whereas men are often congratulated on achievement, on individuality, on putting themselves above others in order to get something done. Whereas that can, and I don't mean it's intentional, certainly, but it is the pattern by which we socialize males and females.
It does sound like kind of the brain needs novelty and a challenge, because that kind of makes sense, doesn't it? If you've got a boring, repetitive job, I don't know, the classical Charlie and the Chocolate Factory, his dad putting the lids on toothpaste. I think that's what his dad's job was. Um, Obviously, a really boring job is not going to stimulate you like someone who's got something very exciting to do. Why does the brain want novelty?
There's this concept called cognitive reserve. So the more rich and varied and exciting things that we do in our lives, the more, I guess, cognitive reserve we have. And the more of it we have, the more of it we can potentially lose before we start to see symptoms of dementia. And I guess really at the end of the day, our brains are wired for novelty. Like if things are interesting, then we're going to be drawn to that. We have these systems in our brain, our reward systems in our brain that pull us to, novel situations. We have these, chemicals that will be released like dopamine in order to drive us to do those things. And that's not a fluke. That is because anything that is new is potentially something that might be beneficial to you in your life.
Lots of women feel like they are multitaskers. I always think that I'm a great multitasker, but again, I've read some evidence recently that would suggest that we're probably not as good at multitasking as we actually think. So, multitasking versus monotasking. What's the best one approach?
Monotasking. Our brain isn't designed to context switch. So our working memory, which is our super short-term memory, which is just holding the information that you're doing right now, that gets overloaded. And during perimenopause and beyond, our working memory doesn't work as well. So multitasking, which is tricky enough for the brain at the best of times, becomes especially hard because we have to hold all that information in our mind at once. Now we've got attentional systems in our brain that allow us to focus on things. And they also really struggle when we're multitasking. So our brain basically has to figure out how to filter out irrelevant information, and it has to decide where it's going to put all of its energy. But that can also get really overwhelmed through perimenopause. So if you think of it like this, so attention only lets so much information through. Okay. The point of attention is only to let as much information as you need to get the job done, to do whatever it is that you're focused on. So you're discarding all of the information that's irrelevant. So classic example, you're in the car, you're talking to someone on the phone while you're driving. You have to pay attention to everything around you. You have to listen to what they're saying. You have to listen to, you have to look at the environment. You have to make sure that what the cars around you are doing, what the traffic lights are doing. And if you're paying too much attention to the words, then that part of the brain of the signal, that signal in the brain is becoming amplified, so you can actually hear what they're saying. But those networks then aren't available for the part of the brain that's focused on driving and visual things. So your attention to driving is going to go down. So you're going to miss things and you're more likely to have an accident. And, just because you're looking at the road doesn't mean that your driving isn't impaired. Okay. So the neurons that are involved in processing visual information aren't going to be as heavily utilized if you're thinking about what you're listening to and you're listening to the words. So sensory overload is really this thing that happens when our senses are being overwhelmed and it's bringing in more information than we can actually process in any particular time. And our attention systems normally allow us to focus on one thing and block out the rest of it. Now, when we become overwhelmed with sensory information or sensory overload, it basically triggers our stress systems, that fight or flight system. Being in a big crowd is a classic example of that. So, you might see kids covering their eyes or their ears because they're becoming overwhelmed by all the sensory information to try and block it out, or they might throw a tantrum. That's because their stress systems are being activated. The kid's not naughty. It's just that sensory overwhelm is triggering that stress response. So ultimately, all of these things are coming together, and it's making it very hard to, do anything more than focus on one thing at a time. So we're designed to monotask, not multitask. And it becomes especially hard through perimenopause and beyond.
Yeah, I think we're probably all guilty of doing that car journey where even if we're chatting on a hands-free phone, which hopefully everyone is if they're doing it, you get to the end of the journey and you think, "Ooh, I can't really remember most of that journey home."
How did I get there?
Yeah,
Yeah.
how did I get there?
Or when you turn down the volume just so you can concentrate on the road.
Yeah, absolutely, absolutely. I wanted to ask you, I know that you have a TEDx talk and you talked about some brain hacks that could be helpful. I wonder, would you share some of those with us today?
Yeah, sure. So the TED Talk was about the secret of learning faster and more effectively. And these are things that I think we intuitively know, but until you realize that there's neuroscience behind it, which is which we're learning more and more over time, that it makes a lot of sense. So things to improve our learning ultimately are attention, alertness, sleep, repetition, taking breaks, and making mistakes. So in order to learn, you've got to pay attention to the thing that you're learning. It makes sense. And you've got to be alert. So you don't want to be tired or sleepy. Those things are fairly intuitive, right? And it's also why things like caffeine can be beneficial because it increases your alertness. And also it's why exercise can be really useful as well because it increases your attention and your alertness. It's basically when you're exercising, it's increasing the level of these neurotransmitters that are important for your attention. So that's why it's a lot easier to pay attention if you've just done some exercise. So if you've got a really important meeting or something that you need to focus on, run up and down the stairs at work or do some star jumps or do whatever it is to get that blood pumping. And that's also going to help you focus on the task at hand. In terms of sleep, well, we need sleep for lots of different things. It resets our metabolism, it resets our emotional control, it resets our immune system. But most importantly for memory, it's when our short-term memories get turned into long-term memories. So when we're sleeping, that's when that process happens. During the course of the day, we have this thing called the hippocampus, which is basically our brain's diary. It's keeping track of what we're doing from minute to minute. And if I was to ask you what you were doing before, doing this podcast, you're using your hippocampus to recall that information. So it's keeping it in there for the short term. But when we sleep, that short-term information then gets moved off into long-term memory storage. So if you don't sleep, then that information just gets eroded. It literally gets removed. Okay. So you have to sleep if you want to have any chance of, consolidating the things that you've learned, whether it's information or, learning a sport or learning a technique or doing something new at work. That sleep is really critical for that. And I think probably my favorite one is the importance of making mistakes. So when we make a mistake, and we feel a bit anxious and feel a bit uncomfortable, that's because we are releasing these neuromodulators and neurotransmitters that help us pay attention. And if you think about it, it makes sense. You've made a mistake and your body has picked up that you've made a mistake and it wants you to do the thing better and it wants you to try again. Okay. So we've got this increase in focus and attention and agitation because the things are linked. And that helps us to then continue and do the task and pay attention so we don't get it wrong. So when we make a mistake and we feel a bit anxious and then we eventually do the thing right, whatever it is that we're trying to learn, we then also release neuromodulators like dopamine. And dopamine is really important, not just for making us feel good, but also it helps to solidify that memory and really consolidate that learning. So that's why it's really handy sometimes to turn your learning into a bit of a game. If you're trying to learn a topic, quiz yourself on the topic before you're ready. Just do the quizzes and test your knowledge. And when you get something wrong, you're going to feel a bit anxious naturally, but you're never going to forget that thing. If you can think about times in your life in the past where you made a mistake, you remember that mistake, right? And that's not a fluke. That is because our brain's chemical processes are there to help us retain that information. So making mistakes, don't frame it as, you're not doing well. Frame it as, great, this is my brain's way of priming me to learn more effectively. And then, of course, breaks. Breaks is a really important thing as well. So our learning, the things that we learn, they're actually pretty fragile. They don't, they're very fragile after we've just made these new connections in the brain. And if you try and do something that is going to take a lot of effort after you've just learnt something, there's actually a chance that you can actually essentially, remove those new connections, essentially wipe the brain clean from the things that you've just learned. So it's really important to take a break after you've learnt something. In adults, we ideally at least an hour after learning something, you want to take that much of a break, which can be really difficult in the workplace setting. You've just learnt something or of a colleague and then you need to then do your work. I think my suggestion would be in that situation is if you have to work, do the tasks that don't require that you can do on autopilot, maybe answering emails or filling out a spreadsheet. Do those things that don't require a lot of focus after you've learnt something new. So all those things together can really be beneficial for increasing our ability to learn more effectively.
This episode is brought to you by my 16-week Rediscover You program, designed specifically for women navigating the challenges of perimenopause and menopause. If you're dealing with disrupted sleep, mood changes, or unexplained weight gain, this evidence-based program combines medical guidance, practical tools, and a supportive community to help you take control of your health. Women have reported significant improvements in symptom management of sleep quality and overall well-being. As an All About You listener, when you mention the podcast, you'll gain priority access for our next intake. Click the link in the show notes to learn more and join. I'd love to help you rediscover the vibrant, confident version of yourself. So Sarah, it's one thing to realize that alcohol isn't serving you, but it's another thing to actually do something about it. We're all drowning in information, but actually making a decision to move forward with something is really challenging. How do you recommend people reduce alcohol? Do you suggest they just gradually reduce it? Do you suggest going cold turkey? Are there pros and cons? Are both acceptable? What way do you tend to suggest people go?
So the first thing to say to that is if you are physically addicted to alcohol, you must never go cold turkey because it can be fatal. And so it's about, first of all, asking yourself, how much am I drinking? And is this an amount where it could actually cause very, very serious issues if I was to suddenly stop? So no one should go cold turkey if they're drinking significant amounts. And if you're unsure, get advice from your GP. Otherwise, I recommend taking a 30-day break and doing it in the support of one of my challenges or one of the other amazing sober programs that are out there, because doing it with other women makes a big difference. And doing it for 30 days is enough time to just be able to go, right. I started drinking at 14. By the time I stopped at 43, I drank alcohol for 29 years. I didn't really know life without it. And I remember saying to myself, the first time I took a break, I intended to do 21 days. I was like, well, what's 21 days out of my life? And I always say, if someone says to me, oh, I can't do 30 days, like I've got that party, I've got that wedding, I've got that holiday. If you can't do 30 days, I would say that's a very clear sign that you need to do 30 days, because we've probably got a very significant emotional reliance on alcohol. So give yourself the opportunity to take 30 days off and see it as an experiment. Don't see it as anything more than that, but just, okay, let's get some data. Let's see, how does my sleep change? How does my mood change? How does my motivation change? Does my anxiety reduce? Do I feel more positive? Do my relationships improve? Do I lose weight? Does my skin look better? Like, just get some reference points to do this little experiment on yourself.
And do you recommend that people navigate this by telling people what they're doing or not telling people what they're doing? Like, if they're in a social situation, do they, drink alcohol-free wine, or do they pretend to hold a glass of wine not to draw attention to it? Or like, how do you recommend people approach that one?
I think it totally depends who you're with. So, like with close people, most grey area drinkers have got to a point where their mental health is starting to suffer as a result of their drinking. And so turning around to the people that you care about and that you love and go, my mental health's been really, really rubbish. And I want to just take a break from booze and see if it improves. So I'm going to be taking a break for a while. I'd love your support. And so I'm just going to be drinking alcohol-free drinks. And, the alcohol-free drinks are amazing now. You can go to a party and no one even knows that you're not drinking alcohol. I was at a dinner party and a woman I'd never met before went to pour me a glass of wine at the table. And I said, oh, no, I don't drink, thank you. And she looked at me and she went, why? Are you an alcoholic? I was just like, wow, I've never met you before. And your association, sometimes it can just be about going, I'm on antibiotics, like whatever you want to say, just to make the situation pass. Because it can be hard, and we don't need pressure from other people to make it even harder.
I've had a couple of, I've never used that phrase before, grey area drinkers, but we've been working quite hard to really reduce their drinking. And in fact, they stopped. And then a few of them have sort of, fallen back into their old habits. And there has been a lot of guilt and shame entwined in it. And then that sort of feeling of like, oh, well, and my friend said I don't really think I have a problem anyway. So it's that whole mixed emotion of, they are disappointed in themselves and they're feeling, a bit horrible about it. But then it's that default, well, look, I was never an alcoholic anyway. So in fact, why am I even doing this in the first place? How do you help people navigate whenever they do fall off the wagon? I don't know if that's the right phrase.
The thing that I teach people is that it's all part of the process. Like, I don't know anyone that decided to change their drinking habits and then just bang, that was it. Like, it's often a process. The thing about grey area drinkers, 99% of the women that come to me, they want me to make them a moderate drinker. So they want to be someone that can just have a glass of champagne every now and then, or a red wine with their steak, but they don't think about alcohol anymore. They're not relying on it anymore. So they want to be a take it or leave it drinker. But the research, the science, all the neuroscience that I've studied shows once you've created those neural pathways in the brain that associate stress or emotional discomfort with using alcohol as a solution, you're probably never going to be able to be a moderate drinker. Like, if you've got to a 6 out of 10 on that scale, you could take a month off, 3 months off, or a year off. And if you pick up a drink again, you will be right back where you were. And I did that twice. I did 100 days, 2 times. And I was like, oh, I'll be fixed now. I'll be a grown-up drinker now that just has a glass of wine every now and then. And within a month, I was just back to drinking the same amount as before, because the associations are so deeply embedded in the brain of what we use alcohol for that it's very, very quick how quickly we go back there. And I teach all of this. And that's why it's so important not to just do it on your own and to actually come into a program like mine or one of the other ones that people run, because you get the neuroscience. You actually start to understand your brain and what the tips of the tools are to actually create long-term change.
You've articulated, I have to say, really clearly what I have seen in my career in medicine, that often women will say to me, I just want to be able to, have a glass of wine at a special occasion, or I just want to be able to, if I go to a barbecue or something, just have one drink. And I think you're absolutely right that it just doesn't seem to be like that's possible. It's they nearly have become, in a way, all or nothing.
Yeah, and then it becomes, well, which way am I going to go? Because there's not 3 options now, there's 2. And the option is I carry on drinking like I am, which isn't working for me anymore for whatever reason. Or I look at what life might be like for a period of time without alcohol. I don't have to stay forever, but I can get curious about what it might be like. And it's hard at the start. Like, there is no doubt that it's hard. But what I see, and I think is really sad, is most people think how hard it is at the start is how hard it will be forever. And so they go back to drinking because it's too hard. But once you get through the hard bit, your whole life starts to change and your whole world starts to open up. And that's what I see my job as, is supporting women through the hard bit to get to the bit where it gets easier, so that they too can experience everything that I have of what a life without alcohol looks like.
The next group of women I see a lot in perimenopause are women who've got awful anxiety.
Yeah.
And they can be sort of 2 groups. One who've always been quite anxious and it's now worse than ever. And then another group who've never been anxious and they are literally feeling like everything is terrifying. One of the common ones I find here on the Central Coast where we live is that people who've maybe lived in Sydney their whole lives, they've moved up here, suddenly terrified of driving in Sydney, whereas it never bothered them at all. Or suddenly husbands and partners are having to drive them to appointments because they're actually scared of having an accident in the car, and they know in their own mind that they haven't had an accident, they haven't even had a near accident, but they're just completely paranoid about it. But this anxiety is very, very troubling. I've had patients give up their job because they've become too anxious to even go to work, or too anxious to do a presentation that they used to always give every month at work. They just can't do it anymore. What is going on there?
Yeah, it's multifaceted, as you said, and I wish I knew the complete answer to that. And the research, as we know, is lagging well behind the actual women's experience of it. We know women are having this, but we're talking about it, and now they're starting to research it. We know that hormones impact our mood and our sense of safety. So it's our risk of threat is influenced by our hormones. Okay, so we can both lower our mood and get a higher sense of threat. So you're talking about that cohort that aren't depressed, or they may be depressed if this goes on for a period of time, but also that sense of threat and what's safe and not safe is exacerbated during this time. Now, we think that's to do mainly with hormonal changes. So what happens is the amygdala, which is the part of the brain that senses threat, seems to be on higher alert during this sort of perimenopause period. So what, as you say, used to be a neutral experience, or maybe if we looked out of 10, maybe a 3 out of 10 in terms of level of threat, 10 being the most and 0 being none, suddenly this thing's a 6 or a 7. So, as you say, with 2 different groups, it's very interesting. So with the group that's never had anxiety before, they're slightly easier to treat because they have an awareness of cognitions that told them something different. They have an awareness that maybe this isn't a fact, because part of cognitive behavior therapy is helping the brain figure out what is fact and what is just being produced as perhaps, a biological process. What is fact and what isn't. And for these women, it's easier because they can sense that, well, easier, I didn't say easy. It's easier because the sense that I know as a fact, I am a good driver. I've always got a sense that I can navigate those Sydney roads. I've got a sense that I am capable. And we can then use that to sort of generate, well, what's different now? What do you think's happening now? And is this a feeling rather than a fact? So we're giving these women the concept of seeing this as a choice, because otherwise when those thoughts come up very rapidly, we see them as the truth. And cognitive behavior therapy is us stepping back from that, observing those thoughts and having choice. Because if we do not give women choice inside their own brains, they will then work on that as if it is a fact. So I can't drive anymore. If you don't challenge that, then that becomes a fact.
Yes.
I can't possibly drive in Sydney. No challenge. The brain sees that as a fact. The brain is stupid and clever all at the same time. It wants to help you. So if you have a thought, I can't drive in Sydney anymore, it'll go, okay, well, let's not do that then. Let's get a plan for not being able to drive in Sydney. And it'll just go down that pathway.
Yeah.
Whereas if we see ourselves as, those of you who've seen the movies Inside Out, where it really gets that idea of there being a controller as being self, and I can observe my thoughts, I can see what they are, see what they're saying, and then have some choice about whether they're the truth or whether they've been generated by an adrenaline surge, changing hormones, perhaps something someone said to me when I was younger, but I have choice now what I do with that thought.
Yeah, absolutely. First of all, love Inside Out. Love that movie. It's so good.
Yeah, that panic attack and that was just nailed.
Oh,
so good.
So good.
Yeah.
CBT, you mentioned that. Tell me, what is that?
What is CBT? Well, it's such a funny one because I've got lots to say about that probably aren't politically correct. So I'll
Go on then.
Yeah, okay, let's go there.
Be a rebel.
So let's go wild talking about CBT. Wow. So cognitive behavior therapy. So when we were sort of moving away from perhaps some of the psychodynamic principles of Freud, and most people would have heard of Freud, and we started to look at some principles for what shaped emotion that were a little bit easier to understand and to formulate, to explain to our clients. And of course, that the wisdom is that, of course, our thoughts have a big influence over a lot of the other systems in our body. So if you were to say, something like, I can't handle speaking to microphones, that would have a cascading effect on you. So you would also start to feel differently about talking to me today. You would also have different emotional experience. And what your cognitive processes will be, including images, might be that you're running out of the room. You might see yourself finally not appearing out to say. So your cognitions can have a significant impact on a lot of other networks. And there is an interplay between them. So the early CBT specialists sort of said, well, your thoughts determine who you are. Your thoughts determine your actions. Your thoughts determine, whether you're able to achieve things or not. And it was a rather simplistic process. So it basically said, if we can identify the thoughts that you're having, that can change your behavior, which can then go on to change your emotions. Now, because everyone comes to therapy to change how they feel. Right? They want to feel differently. We only have so many mechanisms to change how people feel. And the early cognitive therapists have said, well, we need to change how you think. Second generation is a lot more sophisticated than that and follows the science. So what it's saying is that, let's just say if you were in a car accident, God forbid that you would be, and the color of the car that hit you was the same color as the jacket I'm wearing. Okay, then I come and see you today for this podcast and you see the jacket, you only were hit 3 days ago, it's the same color. Before you've even had a thought, you've had a biological reaction to me. Now, that is the first reaction. That's not a cognitive reaction, that's a physiological reaction. So the second wave has said, let's take this into account. Fortunately, second wave therapies also take into account things like beta hormones. Your hormones will also change your mood states. And so now there's this sense of feeling depressed. You didn't have a cognition first, you had a feeling first. That, if we're not careful, will go on and influence your cognition. So now in the second wave, we're looking at the interplay much more between physiological reactions, emotional reactions, behaviors, and cognitive processing, including images, including sensations, because we know a lot of trauma relates to the olfactory sense, which of course is the one that first hits the brain. So we know that smell is very important in trauma. So we brought those in. So that's important. And then the good CBT therapist will also track that back to childhood. Yes, because as we've talked about, you with your swimming pool and you with your sense of good girl, etc., they're all related to childhood, where the brain is 90% of its adult size at the age of 5. The neural networks that determine who we are largely formed by the time we're 4. Attachment patterns, in terms of the sense of I am and others are formed, but largely by about 11 months. So we know that those early interactions are incredibly important in terms of how that person goes on to interact with the world. And if we don't track back, we're missing a large piece of the puzzle for that client in giving them some tools and strategies to have choice. As I said, I know when I was younger, I wasn't safe. I know when I was younger, people hurt me. But I have choice about whether I continue that today. Now, again, I didn't use the word easy. I said we have choice, and that can take some time to develop. But being that person that can be aware of physiological reactions, being aware of emotions, being aware of cognitive processes, and sometimes being aware of what we think is sort of more like an unconscious behavior, like that sort of sense of that drawing back from someone who might have physiological characteristics that remind you of an abuser or someone else, that's a behavior, then we can have choice over whether we do that.
Sometimes I have patients who will say things like, oh, I've got a really good friend or mother, sister, insert whoever, and I talk to them all the time, and so I don't need to see a therapist. And my really simple way of saying why I think everyone should have a psychologist personally, and that's just a thought. But I think that what is different than your friend, your mother, your neighbor, whoever, is that in that room, you can be 100% honest without worrying that they're going to be offended or worried or upset, or you're going to stress them out, or that they're going to think differently about you because of what you've said. So that's kind of how I try and frame it. Is there anything that you would add to that as to why it is different talking to a psychologist?
Okay.
Apart from all the training, of course.
Yeah, apart from that. But no, I think you make a really good point because it can cover two things here. One is it's really important to have a good enough relationship with your therapist. So relationships matter. So if you've got some really good girlfriends, whatever, that's wonderful. And if you can relate to them, great. So they might be your first port of call because relationships matter. However, as you said beautifully, the goal if you're in a relationship with someone is to maintain the relationship. No one wants to lose a relationship with their mom or their sister or their bestie, which means that that other person may not be in a position necessarily to challenge some of the story that you're sharing. They may not be in a position to suggest maybe doing things differently because the goal will be to keep the relationship. The other thing also will be that you're mindful of offending that person and that person offending you. In relational stuff, we're equal. So I get to share my story, you get to share your story. That's equal. But if you've got a really big problem and someone says, yeah, I know, I when I walked my dog the other day and I couldn't find anywhere to find another poo bag, it was really stressful, and the other person's just lost, a family member. Because there's that need for equality, those things can actually really get in the way of that person actually finding a place to really validate their story. As you said, it's not equal in a therapeutic relationship. The therapist is purely there for the other person, and you don't know often about your therapist a lot about their personal life because actually it's irrelevant. So the relationship matters, the fact that that person's important. If you've got a therapist sharing too much about themselves, I would question whether it's a healthy dynamic between the two of you. But anyway, apart from that, so what you're looking for then is the skill base that therapist brings. So again, that's when the training comes in for how to challenge someone else, how to use the strategy that's appropriate for that person. And that'll take into account a lot of the things which we use in motivational interviewing, which is whether you've got a client in front of you who's at the pre-contemplation stage, contemplation stage, planning stage, or action phase of wanting to make change. Now, if you don't know how to assess where that person's up to, you might come in at the wrong phase, and therefore you'll have a mismatch with what that person's needs are. And of course, I would presume that most friends, aunties, sisters, whatever, aren't trained to know what intervention is required and at what level.
So you talked about that you were using alcohol as a bit of a crutch to overcome anxiety and overcome imposter syndrome in work. So what happened at work whenever the alcohol was gone?
Yeah, so the alcohol was never gone. That was the trick, right? Like, so when you're using a substance to cope with emotions, you just go and find it wherever. So if I didn't find it at work, I'd just go home and I drive through the bottle shop, drive through.
Oh, sorry.
I know
I
it.
mean, when you stopped,
Oh, so
how was it at work then
sorry.
once the alcohol was gone?
Oh, so I understand what you're saying. So once I stopped drinking and I was still working in radio, I did a lot of just deep dive questioning of myself. And in that month, I learned a lot about myself. And so instead of drinking away those feelings, I actually just started like processing my emotions, which sounds really scary, but the alcohol had suppressed those emotions. The alcohol had dampened those feelings and numbed me out. And what happened when I stopped drinking, I did feel lots more emotions, but I felt like I had a capacity to process them, talk about them. I went to therapy and I started actually dealing with some of those feelings. And what I figured out pretty quickly, which I didn't realize about myself, which is pretty funny, I always thought I was an extrovert because I've got a bit of a personality. I've always worked in media. I love being on a stage in front of a crowd. But then this weird thing would happen when I was going to an event. I would always feel really, really uncomfortable. So I would have a glass of wine before I even got out the door just to like dissipate those feelings. And what I've realized since I stopped drinking is I'm actually an introvert with an extroverted personality. And so the way that I reset and regroup and relax is alone and not around people because people drain me. And my husband's the opposite. He is an extroverted extrovert. He loves being around people. He loves being social. He gets his energy from being around other people. And I thought that that was me for most of my life. I thought that's what I needed. I need to be around people because they're going to refuel my fire. They're going to help me, get what I need. And what I've realized is that was completely taxing me. And so I think I learned all of this over a few months. So it was just a big learning curve. I finally was learning about myself, and it's stuff that I had, instead of trying to learn, I just pushed aside and away. So the drinks were still there. I just wasn't having them. So the biggest change is that I just made a choice, right? So instead of activating, let's just drink because these feelings don't feel great, I activated, we're not drinking because I know how to process my emotions now. So the switch was just me. And it is actually a very simple switch.
Very, very deep though. And a lot
Very
of
deep.
people will, understandably,
Yeah.
try and avoid it. Because of course you have to
it's
sit with feelings that feel really uncomfortable.
It's hard, and we don't like feeling uncomfortable, and that's okay. But you just have to sit with yourself. That was what it was. It was a big look, a long hard look in the mirror, and a long hard look, going like, who are you without alcohol? And maybe you will be a better version of yourself without it. So let's just try and explore who she is. So I didn't just go on a mission to like stop drinking. It was more about discovering who I was without alcohol. And I think they're two very different headspaces to go into sobriety with. I think if all you're trying to do is stop drinking, the novelty will wear off. You will stop drinking for a period of time and then you'll go, great, I nailed it. And then you go back to drinking. Whereas if you're on an exploration or like a discovery of self, that's endless. So my journey of discovery of Maz Compton without alcohol is 10 years down the track and still going. And I'm not bored of that yet. The novelty hasn't worn off because I'm still discovering stuff about me.
And how did your work colleagues respond?
Terribly at first. So like I said, that core group of people that I was carrying on with were all doing the same thing as me. And so when I didn't really announce it. I just quietly told a few people, I was like, hey, I'm just not drinking right now. And it was like, what's wrong with you?
Are you pregnant?
Why are you being so boring? Are you pregnant? One person said, come and talk to me when you're drinking again. Because like basically the friendship's on hold until that happened. So they were really hurtful things, but also I had expected that. And I also was like, I'm not going to let this change I was so headstrong and heartstrong in my decision. So I didn't have a great response. I didn't really have anyone support me other than the two people that I told leading into my sobriety, which was my boyfriend at the time, who's now my husband, Glenn. I remember I called him. So we were in a long distance relationship at the time that I decided to go sober. I rang, so I was in Melbourne and he was in Sydney, and I rang and I was like, hi. And we'd only just started dating. And I was like, I have something to tell you. And I said, and after I say this, like, I completely understand if you want to just push pause on our relationship or move on or whatever. And he was just like, what is it? And I was like, I think I have a drinking problem and I'm going to take some time away from alcohol. And he was like, oh, is that all? I'm like, yeah, this is a big deal. And he was like, well, what do you need from me? Like, best response ever. What do you need from me? I'm like, I just need you to like not drink around me for a little bit and just to see how I go. And he's like, cool. From when? I'm like, January 1. And he's like, great, done. Like, it was so supportive and beautiful. Hence why I married him. And then I rang my mum and I told my mum. And she was so shocked because she was like, what are you talking about? She's like, you don't have a drinking problem. I was like, yeah, I do, Mum. I'm like, and I haven't been honest with you about my drinking behavior and how severe it's gotten. And so let me paint you a picture. This is where it's at and I want it to change. And so again, she said, how can I support you? And I said, when I come over, just don't open a bottle of wine and we'll go from there. And so knowing that I had those two kind of sober support people have my back from early on in the journey, I didn't feel like I needed any of my friends or colleagues to understand what I was embarking on at the time, and I just sort of let them have their opinions and just sort of like really lent into those two relationships that were nurturing my sobriety.
Maz, you're incredible. I think the level of insight that you had into what was going on is actually phenomenal, to be honest. I think it's quite unusual.
Yeah, I've had a lot of time to think about this. I've written a book about it. I've done podcasts about it, and I love talking about it. And I really think all it is I got to a point in my life that so many people get to where you're just fed up with your choices. And I couldn't figure out, I was like, I'm a really smart person. I'm really savvy. I don't want to do something and I keep doing it. Like, what is that? And I think we all struggle with this in different areas of our life. I think the drinking issue for me was the one that really brought it to a head where I was like, what is the disconnect in my brain? Why can't I marry these two things together? Why do I feel like I have to keep drinking in order to like get through life instead of making a different choice? And it really, when you're at that point, I think it becomes simple because then you just have to make the decision and it's one choice at a time, right? So the choice was from January 1, 2015, regardless of what happens, if I win the lottery, if my best friend dies, if I don't know, like if I get another dream job or an opportunity or if something awful happens or if I have an accident, like whatever happens today, I'm not drinking alcohol. And that's it every day. And it's been like, I don't even think about it now. But in the beginning, it was a really conscious decision. And I don't think it's about willpower either. I just think it's about allowing yourself to be true to what you really want. And if you really want to stop drinking, then just stop drinking. I know it sounds really easy when I say it like that, and I know how difficult it is, but when you simplify it like that, you take all the pressure off, it actually does become we are the sum total of all of our choices, and we only have a set number of days here, and I just want to make great choices as often as I can. And I think that's a really easy way to live life than the trap that we hold ourselves in constantly when we think that we can't do things when really we can if we choose to.
Yeah, absolutely. I have so many thoughts in my head here. I think one of the things is that we live in Australia and alcohol is just so much of the culture here. And it is funny because I'm from Northern Ireland and I often have Australians say to me, oh, well, you're from Ireland and you must love to drink and blah, blah, blah. And I'm not a big drinker and I never have been. But I always find that really funny because I see alcohol way more part of life, everyday life in Australia than it ever was in Northern Ireland, actually. So,
Interesting.
like, I'll give you an example. If you went to a kids' game of sport in Northern Ireland, it would be unheard of to see parents on the sidelines having a drink.
Right.
But I've been to sports games here where the clubhouse is open and everyone's drinking. So I think it
Yeah.
is very ingrained in
It is.
Australian society.
Mm.
And And also, as you said, like people think that you're boring or why can't you just relax or why are you being so uptight? And I know even in my group of friends, there's been occasions where people have been doing try July or
Yeah.
try January or whatever. And other people have kind of commented, oh, stop being so boring. And it's like this constant messaging.
Mm.
And then I think the other thing is, I was even thinking of my 16-year-old daughter. We'd just been on holiday and, she was kind of like looking at the cocktail lists and she was saying, oh, I can't wait until I'm 18. And we were in the US and I said, well, you'd have to be 21 anyway. So.
Yeah, true.
But isn't it
Yeah.
interesting? Because I think that's as a society how we're really set up.
Yeah.
It's like to get to this age, to get to the legal age of
Yeah.
drinking. Whenever you were a teen, was that something that was in your friendship group?
Absolutely. It was binge drinking at 15, 16 was very normal where I grew up, and I definitely participated in that, and I highly regret it these days. But yeah, it was just a no-brainer and a rite of passage. But the reason why I love having these conversations is I really hope, so I have a 6-year-old son. I hope by the time he's a teenager that we've been that we are able to turn this ferry around. Because currently this is what happens. If you go to a bar with a group of friends and you are not drinking, someone will say to you, what is wrong? And I hope that we're able to turn this all around so that in the future, when we're socializing with our friends and one person is drinking heavily, that we all go, hey, mate, you're having a bit to drink. What's wrong? Because that's actually the right way round. The people that are drinking are usually the people that have pain points that they're trying to dissipate, and they're doing it through substance abuse. They don't realize it. They might just say, it's just one, I'm just being social, my mate got married, whatever happened, whatever. But I do think people use alcohol as that multi-tool of coping because they don't know how to process and manage their emotional health. So if we can get people to process their emotions a little bit better and look after their emotional health, they might not need that alcoholic drink. So I hope that the tide is going to turn where this next generation of kids that are coming through are going to see alcohol for what it really is and not lie to themselves about what they think it should be in their lives. And that, yeah, the person who's drinking is the person that gets asked, hey, do you want to have a chat? Because there's clearly something up with you because you're the person that needs to have alcohol right now. And I think we're getting there. Like, when you look at the data, the younger generation, so the kids who are turning 18, 19 and 20 now are drinking less than what we ever did. So, and one of the heaviest demographics of drinkers in Australia are women in their late 40s and early 50s, which is terrifying, but that is the fact. So I think that we are going to be able to turn it around. That's my hope anyway. And that's why I'm so passionate about having these conversations. I think our generation's not a lost cause, but it's harder to get somebody to be sober when they've been drinking for so long. We can start having the conversation with our young ones to hopefully get them to a point where they never become dependent on a substance.
Yeah, the younger generation are amazing. They've so embraced sort of healthiness.
Yeah.
They know so much more about healthy eating and, water intake and going to the gym and being fit than we ever knew.
Which is great. And, information is, knowledge is power. So all of that is so good. I also think there's this undertone of so parents who say are in their 50s and 60s, if they're heavy drinkers, I think that their kids would look at their parents' behavior and go, well, I don't want to do that. It's like we were all on Facebook and then our parents got on Facebook. So then we went to Instagram, right? Like you just don't want to be doing what your parents do. It's just a generational thing. And I think because the heaviest drinkers are in their 40s and 50s, that those people's children will just naturally be going, well, I'm not going to be doing that because that's what mum and dad did. And I don't want to binge drink with my girlfriends and be, and have a few wines under my belt for the school pickup. I don't want to do that for my family. So there's that element of society that I think is going to shift as well.